cause of obesity is a lot of times is calorie intake and poor fitness that contributes to the majority of it. But we also see other contributors to this. Sometimes other people have different ailments that prohibit them from doing certain things to stay active. They have genetic problems that also contribute to obesity. We see, a lot of people have started to experience, I guess, in a population sense, we look at over the decades, there's a big uptick in obesity in this nation when we started having highly processed foods in the market. And so people going for easy choices there, and also these contribute to poor gut health with the microbiome, and that area also contributes to it. So it's multifactorial. Dieting alone isn't going to fix the problem. In fact, sometimes it actually makes it worse. I see a lot of people that come through the clinic doors and they've been dieting for years, and we call them yo-yo dieters because they go on a diet and they lose weight. They're excited by that, and then they stop the diet and their weight goes back up, or usually goes beyond where they were at before. We see that even with fasting diets. We see that with the preferential meat only diets. What's important for people to have success out of this is to not see it as a diet, but as how they live. In fact, sometimes the best way to explain it is like having a severe food allergy. So if it's something about simple sugars or, breads and pastas, like that you have to avoid those because, say, if you were to eat it, it would put you in the hospital. You wouldn't want to do that. You would be really good about avoiding those foods. And that's kind of how the mentality that people have to change. They have to embrace that as, this is me, this is how I live, these are the choices I make, and not continue to bounce back and forth, or they will get yo-yo dieting effect.